House Republicans have now passed a bill that the received wisdom is will go nowhere in the Senate. They'll start again and write a new program. What's your best estimate or best guess as to what they're going to end up with?
In the Senate, I think you're more likely to wind up with something like the Cassidy-Collins plan, which really goes much lighter at the federal level and basically devolves a lot of decision-making to the states through waiver authority. That's the lightest touch approach in which you can try to hold together this shaky coalition that the Senate Republicans will have to use to move forward.
Paul Ryan has been all about waivers, particularly for Medicaid, which he wants to make a block grant so that, as he says, states can experiment. What are they talking about when they talk about states experiment or having flexibility?
Well, I want to say there is plenty of room for making Medicaid work better, and the basic idea of waivers in Medicaid, A, have been around for a long time, and B, is something that has bipartisan support. It's all about how you do it, and the thought that you can just wave your hand and take north of $800 billion out of Medicaid, as the American Health Care Act does, and think that you're not going to dramatically reduce coverage in Medicaid is just, I mean, it's not planetary. The math doesn't work.
That's one of the debates. The other debate is what you do in general about health care, particularly costs, and that's something you've been writing on, and that's the subject of this conference here.
Yeah, and that's the great shame here in terms of this ongoing turmoil over repeal and replace, because for most Americans, we lose sight of the fact that 155 million Americans are covered by employer-sponsored insurance. The number of people on the exchanges is, a tenth of that. And so the exchange coverage debate has been getting all the attention, but for most Americans, what really is going to drive the future with regard to their health care is what are we doing on cost and what are we doing on value? And almost all of this debate is ignoring those issues.
Technology, is that the answer?
It's one of the answers. It's not the only answer. We need to change the way that we pay for health care, move away from fee-for-service and towards paying for value. We do need innovation, and that will be partially driven by the changes in how we pay for healthcare. And we do need more people to take responsibility for their own health. So it's a combination of, there's no one magic bullet here.
Now, going back to the debate over the House bill, one of the issues was Republicans voted on it without knowing what was in it. There's no CBO score. But it's also been said that it's going to be tough for CBO to score a bill like that because the bill the results depend on how many states decide they want to opt out of these programs. So how do you score something like that, and can we trust CBO's estimates?
Oh, we can CBO is a highly professional organization and does a terrific job. It has said that it will be scoring the American Health Care Act. The score will be out in something like 10 days or so. It is difficult to score something where you have state waiver authority and state optionality. In the past, what CBO has tried to do is, instead of going state by state and evaluating which state will do what, take a sort of aggregate approach of saying, let's say a quarter of states will do X, and then evaluate it from that perspective. But let's also back up here. Do not expect the results to be dramatically different than the fairly disastrous score that CBO issued on the previous version of this House legislation before all the additional amendments. I would be shocked, for example, if we didn't wind up with a CBO score that showed that more than 20 million people lose insurance in 2024 because of this new legislation.
Republicans, though, like to say CBO was wrong about how many people would be on the exchanges.
But that is completely misleading. CBO was spot on with regard to the number of people who would be uninsured. They did get the mix wrong. There were fewer people who, the decline in employer-sponsored insurance was smaller, and the number of people on the exchanges was also smaller. But what really matters is what happened to the net number of people without insurance, and there they were almost exactly spot on, although the mix was off.
As long as we have you here, let me ask you about a couple other Trump initiatives. One, the tax cut. Just given the arithmetical loss of revenue from cutting taxes, can you design a revenue-neutral tax program?
Oh, you can design a revenue-neutral tax program. It's all about the politics. Tax reform is really easy at the aggregate level. It gets really hard when you get detailed. And right now, they haven't really put a lot of meat on the bones. So it's easy to say we're going to broaden the base and lower the rate. Broadening the base, that is getting rid of existing tax exclusions, is really, really difficult.
Are you going to be able to give people tax cuts and not blow up the deficit?
I think what you're going to wind up seeing from the administration is a much more emphasis on tax cuts and much less emphasis on paying for them, and instead a reliance on the magic elixir of economic growth, which will be mostly an assumption as opposed to reality.
Is their growth estimate at all realistic?
Well, they have varying growth estimates, but let me put it this way. We have to understand that the workforce is aging, and so the potential growth rate of the U.S. economy is not what it was in the 1970s or 80s. Saying you could hit 4% today is like saying you could hit 5.5% a few decades ago. So it would require just an explosion in productivity growth that we have, that might happen, but you can't, it's not, you shouldn't assume that it will happen. And it certainly won't follow from a deficit finance set of tax cuts.